Before we get into the specifics of the posture block system, I wanted to do a quick posture review with you. The picture you see on the far left is a normal neutral lateral posture with a plumb line passing through the center of the ear, shoulder, hip, knee, and landing just in front of the ankle. Now contrast that with a forward head posture profile that we see on the two pictures to the right, where the head is forward of the shoulder, the upper body has drifted backward, and we have an increase in the lumbar lordosis from an increased pelvic tilt. I call this the trilogy of forward head posture. These are three things that you will always see when you see a person with the head forward, and this has to do with the body's need to rebalance or counterbalance or compensate for these shifts of weight off the center line. So the head will move forward, shoulders drift back, pelvis will tilt forward. Now the tilting pelvis can also be the first domino to fall over. In a pregnant woman or a person who has gained a lot of weight, that weight gain will tilt the pelvis. And again, to compensate, the upper body drifts back, and as the third point of compensation, the head will move forward. Now we see what happens to this straight line in a normal neutral, what happens to it in a forward head posture. We have a curving of that line, and that creates muscle groups that are inefficient. We have very predictable muscle groups that will stretch and become weak, and other muscle groups that will shorten and become weak. We know what those muscles are, which of the muscle groups this happens to, and how they are affected. So a posture correction or a reprogramming plan takes into account how those muscles have to be reprogrammed. First and foremost, we need a spine that is mobile to accept these muscle changes. So spinal mobilization is critical to any posture reprogramming system. And then secondary to that are stretches and exercises designed to target certain muscle groups and to reverse changes that have happened in those muscles. And then third is our posture blocks system, which is designed to passively replicate 6 of the stretches and exercises that a person would normally do to correct forward head posture. The advantage of the posture block systems is that it's very effective and it's passive. The patient simply lays on these cushions, and the effect of gravity, the weight of the body, the resistance of the cushion will actually make changes. And in the next section, we're going to review in detail each of the components of the posture block system and how they come into play to correct forward head posture. I wanted to give you an overview of the posture blocks system. So the first thing we're going to do is explode the posture blocks, give you another view of this, and explain what each of the pieces are for. The first piece is the base of the posture blocks system, upon which all the other pieces of foam will rest. These two brown pieces allow the head to drop down in a very slow fashion over a period of time. You'll insert or remove these pieces according to how much tension you want to place on the patient's neck. This cervical roll allows for a mild traction in the neck and allows the pivot point so this head can drop down to or below the level of the shoulder. This wedge fits in the upper thoracic area and pushes forward, opening up the chest cavity in the front. This second roll is used as a youth cervical roll, or in the adult provides some additional support in the low back. And this last piece is an additional thoracic support to allow more or less tension of the wedge so that you can adjust the intensity of the effects of posture block, starting out with a lower intensity in the beginning, and then as the person begins to mold to that, you can make the cushion system a little more aggressive. Now let's put it all back together, and you'll see how these pieces work as a unit now. We'll give you a different angle to view this. You can see how everything works as a team to reverse the effects of the changes in the muscle groups from forward head posture. The posture block system actually duplicates 6 of the stretches and exercises that the patient will normally be doing on a daily basis. Now, it's important that the patient not lay on the posture blocks for more than 15 to 20 minutes a day. The reason for this is not a pillow. This is not a cushion system that makes somebody feel better while they're laying on it. The effects of this cushion system happen after the fact, and you will have and you should prepare the patient to realize that they will experience some muscle tenderness when they get off this cushion, and you want that to happen. That means that it's actually doing what it's supposed to do, which is pushing and pulling and resisting and making soft tissue changes simply from the weight of their body and the pull of gravity and the shape and resistance of the individual cushions. This is a real system that will have therapeutic effects. The last thing I wanted to point out is a person's arm position while they're laying. What you're seeing is their maximum position of over and up, kind of up in a hold-up position. This allows for the maximum external shoulder rotation. Patient may not be able to start off in that position. They may have to start off with their hands laying down at their sides, and that's okay. This is all about gradual changes and not trying to make everything move where you want it to be on the first day. But this, what we're seeing, is the ultimate position that within 4 weeks we want the patient to be able to assume this position. So that's an overview of the posture blocks system. If you have any other questions, please give me a call.